welcome back to Growinmind here, and I have my co-host with me today, Paisley, and we're gonna dive into some conversations. But before we go into that, we're just gonna give a little recap on who we are and what we do. My name is Laura. I'm a mental health therapist, and my goal is to kind of break the stigma on mental health, especially when it comes to my demographic and my culture, and just create more awareness on the importance of mental health.
My name is Paisley. I work as a nurse here in Alberta, and I am a queer identifying individual.
Right. All right, so guys, the reason I have Paisley here is because whenever we are talking, we tend to have a lot of conversations on a whole workload of things. And I feel like she's always the best person to kind of like check me and also give more advice and education and ways for us to kind of broaden our awareness on a lot of things happening. So the reason I have her here is because being a counselor, the one thing I have started to identify is that we work with a whole wide group of demographic, and going to school, we learn a lot about like what cultural competency is or what it is to be a multicultural competent counselor. But I feel like a lot of things in theory and in practice is very different. Like when you come in is a lot different from how you learn it in school. And one of my encounters that I've had is working with the LGBTQ community, especially the trans or people who identify with like a different pronouns. And I guess my question is, I'm coming in as a cis counselor, cis, Black, and heterosexual. So I feel like for example, I had a client that I worked with that at the end of the session really thanked me for just listening to what their presenting problems was for their presenting problem and not because they identified as trans. And for that individual to thank me made me realize that there are probably a lot of counselors out there who are, rather than listening to whatever the presenting problem is, they are always trying to associate it with whatever the client might be going through or what they feel like, okay, well, maybe because this individual transitioned, they're experiencing depression due to their transition. And sometimes it's not really because of the transition, they're experiencing depression. So I think my question to you is, as a cis counselor, how do you feel that I could be more culturally competent when working with the LGBTQ community?
I think it's anyone who's not a part of a minority is like doing their own research, and understanding like, I guess like research in terms of like the queer community and how things, I guess, like Marsha P. Johnson, like her putting so much work forward for us to be fortunate enough to be out in the community. Also knowing like 2S LGBTQIA is like the newest acronym at the moment. So just trying to be as aware and informed of that. But I think that's kind of all something that you kind of do on your own. In terms of like client-based, I would kind of like maybe like intro sessions, just inform them that like what your values are, and what you do and do not judge. And then also maybe like asking them, because some people, gender is a really, really important thing, like do not misgender them. And then individuals who aren't really, not that they don't care about gender, but they are like myself, present as a female and were born in a body as a female, and I don't feel the need to let people know my pronouns.
Okay.
So yeah, I would just kind of like ask your client and be like, is there a preferred pronoun that you like to use? If you see maybe like on their intake form, they're like maybe trans, for instance, and they're in their transition, maybe asking them like ways in which you can like provide conversation that makes them feel a bit more comfortable.
Okay.
I think it's kind of client-based, and you'd have to maybe ask them how they feel about it.
Okay. So I guess one question I would ask to you is, with trying to, find a counselor, do you feel like you've had any struggles with finding a counselor that fits what you need?
Yes. But for me, identity is like my queer identity is kind of like something that I can hide.
Okay.
And so, not that I want to hide it, but I don't go out of the way to make sure that I'm going to be finding a therapist who is queer.
Okay.
Um, I do like to know that they can at least put in their bio that like they are queer friendly,
Okay.
or they have had clients who are queer identifying. But my concern mainly was finding a therapist who was Black, just because I did have a therapist who was a person of color. But there's just a few things that like required explanation that like if we were of the same race, wouldn't require that explanation. But even then, finding somebody who was of the same color, there is cultural differences for me just because I have been born and raised here in Canada. So I don't really relate to a lot of things in that sense. So in terms of finding a counselor, I would say for me personally, it was harder to find somebody I felt that I could like have that unspoken understanding when it came to race. And then my sexuality was like a second thing, like seeing how they can comfortably talk about me being a queer person was more something I noticed as our sessions like went on.
Okay. So when you had Caucasian counselors, did you find yourself more explaining a lot in therapy?
I've only had one white counselor, but that's when I was like really, really young.
Right.
And then I'm so sorry, Lily's playing with her toy. And so then after her, I hadn't gone to therapy for a long time, and then the therapist that I reached out to, she was Asian. So like there was an understanding of being, excuse me, a person of color, but she was not Black. And so then the next person I was with, she was Black, but there's more of a cultural difference, or maybe it was like a personality thing. Like they were really kind, but I feel like their values were a bit different based off of how they were raised.
Do you mind explaining a little bit further on that?
It's all assumption, but it just felt very much like the whole like getting married soon and having kids and like respecting your parents type narrative was like very important for them. And like for me, it's like I might get married, I might not. Kids, sure, don't know. And yes, I have a parent and I try my best to respect them, but I'm also my own individual and I'm an adult. And so there are boundaries that I felt were or are necessary to uphold to keep myself happy and to maintain any sort of relationship.
Okay. And you mentioned earlier that it was kind of sort of assumptions, but was there anything that the individual maybe said or that kind of made
There had to have been like body language or the way they spoke to me. Like there wasn't like one huge incident where I was like, oh yeah, like we don't get along. Well, actually there was one in terms of my mental health and like seeing somebody for possible diagnosis for whatever. And like their suggestion was just to like the way that they were offering help just didn't seem helpful. So I just felt like that was also a reason it just wasn't really working.
Okay. And the reason I asked you that is very important to me as well, because I know like in this space where we come into counseling and we're trying to create this like unjudgmental bias kind of environment, sometimes unfortunately we could unknowingly say things, whether that's verbal or non-verbal body language, that could pass across to the individual very differently, and they can interpret things that maybe, like you said, like, okay, maybe we're just not on the same with certain things. like maybe morals and values. And it's interesting because in walking in this space of trying to be a competent counselor, the one thing, like I said, the one thing that made me go into this field was trying to bridge that gap on like people of our color trying to go more to therapy because they see someone who identifies as them. Like they understand part of my struggles. They can kind of, there's certain things I don't have to over explain. But the one thing I'm also learning too is in trying to be competent, skills and techniques that might work for a white person might not necessarily work for a Black person. And so I remember I was watching this scenario on YouTube, and it was a white counselor that I was talking to. I think it was an Indian, and she was trying to get the individual to establish boundaries with their parent. But also being a Caucasian is kind of like, like put you first. Like it's all about you. But coming from a culture that's very collective, it's like they can't really go against their parents because there's this sense of like utmost respect. So I could tell that the suggestions that she was given would work for a white person, but could not necessarily work for an Indian person. Because I feel like it's easier for a white person to maybe go up to their parents and talk about wanting to set boundaries, but necessarily not easy for like someone like me or like an Indian person, because I know until I got to a certain age when I started telling my own parents about boundaries, but living in their house trying to establish boundaries is a bit different because it's not like my house, my roof, you have to do what I say. So it's like, how can I even try to establish boundaries in a space like that when I don't feel like I have a say and to a lot of things? And she was kind of like, oh, you can tell them not to do like, like, don't talk to me this way, or like, I hear what you're saying. And I was just kind of like, I can see how there's such a gap, because I get it. It's worked for a lot of her clients, but when you're having someone of a different ethnic background or a different demographic, that same might not work. So although in this space, they keep talking about like, there's always a chapter on competency, I feel like a lot of the techniques, skills, even the therapeutic orientation that we use, it's hard to modify it to fit other demographics.
I think maybe that will come with time. I think if you're mindful and aware that like you are a Caucasian individual and like you're trying your best to make sure that the people that you are in therapy sessions with aren't only similar individuals that look like you, then I think you're going to try, or I hope that you would try to be a bit more knowledgeable to different cultures and different dynamics at home. But it definitely is easier to have to be with somebody who understands, whether that's like an Indigenous therapist.
Right.
Like there's always some bit of understanding when it's somebody who looks like you, and like that's just kind of inevitable. Like, and so I think that if you're going to be with somebody who is outside of your race, oh my god, outside of your race as a therapist, that either they make it a point to be like, I'm fully aware that there will be some hiccups and I might require further explanation. Right. I am trying my best and I'm doing these things to become more knowledgeable in areas that I'm not knowledgeable in. But I think it's just like the onus of like, I am not fully educated and aware in this area, but please know I'm doing my best. And that might work for some individuals, and some individuals will be like, I get it and I appreciate that that's kind of where you're at, but like I'm in therapy and that is a bit maybe like daunting or exhausting to have to think of that. And like that's
Right.
kind of up to the client, I think.
Okay. That's actually a really good point. And one thing I want a lot of new therapists or new coming into this space is really identifying that because a client might not be comfortable with you doesn't automatically make you a bad therapist. As long as you feel like you're doing your part, like you've mentioned, like even giving a little bit of a heads up before therapy session comes, and let the client determine if they think you're a fit, if they want to give it a try or not. Maybe because, like you said, they're not in that space to start over explaining. But I think therapists as well shouldn't take that as they're not competent enough in some sense,
Right.
and be open to also transferring that individual to probably somebody that they feel like they will be able to help them better. Like, for example, if an Indigenous person comes to me, they might struggle, they might think that I might not be able to fully understand because I haven't gone through a lot of the experiences that they have gone through. And
Exactly.
so I also have to be more willing to and sit in that space of I understand, and
Yeah.
be able to direct that individual to an Indigenous counselor who they feel like they'll be able to relate more with, and don't have to really over explain on a lot of the traumatic incidents that has passed on through generations.
Right.
So, like, for me, I guess I would say, do you also feel that in the space of nursing, the competency of working with a different demographic is also something that you encountered as a struggle when you first started?
Well, I just think lots of things in society is very rooted in like uh, white supremacy and systemic racism and all of that. And so when you are growing up, or when you're in a nursing, when you start nursing, it's a lot of it starts with like the white woman, and you're supposed to dress a certain way. Like it already starts that narrative of like expectations and how you should represent yourself. I'm sure that's changed, but that's like something we did have to learn about when we started nursing. Um, and then in terms of you like learning about any body system, any like rashes, like all diseases are based off of the binary of being hetero and white. And so it's great because a lot of the people that well, I guess here in Alberta anyway, there's a lot of people who are in school and are white and hetero. So for them, it's like, this is absolutely normal. They see no problem with it. But when you aren't taught to look at any other body other than somebody who looks one way, and none of that, like, I guess, like, internalized racism or homophobia or whatever has ever had to be brought to your attention, because it's never something that you have to think about in school. When you are when you go out in public and you're on your own and you see patients, again, a lot of them are white, but you will have patients of color and patients who don't fit the binary. And so I think it can be unsafe for those individuals, those patients, because they're in very vulnerable states. It's their sole responsibility to trust these people, to take care of them and know what's best for them. And a lot of the people in the healthcare system aren't always in the healthcare system because they genuinely want what's best for their patient, regardless of how they identify or how they look. And so there's all of those biases that come into play with your treatment. Simple things of like certain races are more sensitive to narcotics than other races. And certain rashes and things show a lot differently on different skin colors. And that can be very important in terms of getting a diagnosis on somebody. But if you're not aware of that, it becomes tricky, and the patient is made to feel crappy and unsafe. And I think it is problematic, but nobody ever really talks about it. And I think it needs to start like in school, like to just change the narrative of even how you're going to go about doing any sort of problem solving. Like, I think it's really, really important, but I don't think it's talked about. And I never really thought about it until recently in terms of like, it was just like the expected norm. Like I'm never going to see anything other than a white body. And like, we have like mannequins and stuff that we'll practice on, and like arms and stuff for like IVs and stuff when you're a student, and they're all white. And that was never something I like was like, oh, that's weird. Like, why don't they have any other color? It's just a norm. So then when you get an arm that is brown or a mannequin that is of different race, it is nice, but they still treat it as if it's the exact same as the whites. And they're just like painting over the whole issue of like, oh, we've now included this brown mannequin or this brown thing. So we've fixed the problem. Here's what you're asking for, you know? And so it's a huge problem that I think will take a long time to fully be addressed, for sure.
So do you feel like your awareness to this kind of everything that's like the differences and things that are taught in school versus like being in the field and having to work with a huge demographic, do you think because you're more aware, you tend to pay more attention?
Yeah, but I also think I am aware because I'm a person of color. So it's like,
Okay.
I already know that like I'm getting a Black patient. Normally they're quite anemic. So like that's not surprising. I know what a bruise looks like on a Black person's body. And sometimes you can't see the bruises and it doesn't mean it's not there. Like those are things that
Right.
like I know because to me that's common knowledge. And I think it is because I am a person of color, but I do think because those are things I care about, I can also spot them and like try my best to be mindful when I am dealing with somebody who's outside of my race that there might be things that I'm not sure of. And like certain people like to have certain types of ceremonies and do certain things at certain times. And like, that's just something that I don't know. And like, I have to check myself and ask those questions. But yeah, I think it comes with like being a person of color. That definitely helps. And then just being curious and, knowing like there's so many things that I don't know that I wasn't taught about certain bodies.
Yeah.
For sure.
And curiosity is like a key thing that you just mentioned, because even as a counselor, that's something I try to constantly keep in my mind when I'm working with my clients is remain curious, remain curious. Even if they say something back, they say something and I'm trying to paraphrase and I'm not sure, like ask more questions, dig a little deeper. And the part of you saying that there's so much to learn, it's so, so key. And this is the point where I'm like I know there is like a long way to go, and I feel like a lot of all this designations, whether it's the AP or anything, they try to gloss over competency to make it be like we touched about it, we're letting individuals who are in this field to know that this is something that they have to do. But like you've mentioned, there are no real clear proper education for us going into the field. Like you've mentioned, like I think you were even telling me one time, like it was a TikTok that said something about like this was the first time they had seen like a Black, like was it a Black reproductive system in like a textbook, because it wasn't something that.
Oh yeah, I had never seen that before, and I saw it on TikTok, which was cool.
Right. And the thing for me is I remember I was working with a client who came in and you could tell this client was in distress, and the basic like like societal questions you ask and the client is like no, but then I noticed that on this individual's wrist they had so many like cut marks on it. And so in that moment you're kind of like, okay, like I've asked like for societal ideation, intent and plan, they've said no to everything, but then you're identifying this stuff. And it was that moment too where like I also had to check myself, where it's kind of like, I remember one thing my supervisor always said, like, we're not investigators, we just kind of have to like ask more questions, right? Like not like we're not trying to like solve, we're not saviors or anything. So like sometimes we just have to take what the client says for what it is. But I had to dig a little deeper just to make sure the client was safe. And I was like, hey, like, so how do you help deal with your stress? And he's just like, oh, there's a religious practice that we like to do that involves cutting. And so in that moment, I was kind of like, okay, where that line of like, it's a religious practice, but it's also something you feel that like is also a risk, right? Like, what if you cut too deep? But I remember like talking to people and it was kind of like, if it's a religious thing, it's a religious thing. Like if they've said no to the ideations, the plans and the intent, they're letting you know that they're not having any suicidal thoughts, they're in distress, but they don't plan on taking their own life. And I remember the whole day just like playing back on that, like, okay, yes, he said no, but then what if like this isn't a religious thing, and what if like this is just a cover up, and you're just going so much back and forth. But then it's like, they said it was a religious practice, they said it was a religious practice, there's nothing much you can go about it. But like, I don't think school prepares you for how complex things are going to be when you get out in that field, and you feel like you're getting contradicting information, but you also have to check yourself, like, well, where is this coming up for me? Why am I so pressed to want to know more, want to save this individual? Like, what is it for me? And so I think a lot of those things, whether it's more scenarios, more explanations, or working with like other demographics, is something that really should be plugged in more in schools. Because like you've mentioned, like a Black person is more like, could be more anemic, so you have to pay attention to that when you're working, like you see an individual in the hospital. Or I know like they say like sometimes Black people have like higher levels of something, and like in comparison to white people, but you're not taught those things in school. And so when you come into the field, there's a lot of misdiagnosis, whether it's in your field or in my field, because you miss so many things that are important for the individual's overall health.
Yeah. Yeah, I don't know. I'm sure there's so many answers, but I do think like education and like being like, maybe they need to make more of a class that's teaching about like the realities of different cultures and different bodies, and like not them all reacting the same. And I mean, like sometimes there was very brief statistics on that. Like we learned that like people who are redhead are very, very sensitive to anesthetic. So like they know that, but most of it is all because of error, like something happening and going wrong. And so that's how they figured it out. Like they didn't go out of their way to try to learn it. It was like, this was the effect of doing something that we normally did on a different body.
Okay. See, yeah, so I don't know, I feel like we're doing our best to pay attention to everything, especially being people of color. I think regardless of whatever field we're in, it's always going to be a hard thing navigating the whole thing, especially because I feel like both our sectors really like come across a lot of the times where it's, I'm telling some of my clients, like, go speak to your doctor. If you need to see a psychiatrist, go see one. But it's also knowing that there is a possibility that they could go see one and also get misdiagnosed or be on the wrong medication, because we're not well informed on the differences. And I try to do my best as a therapist to really see things through my clients' lenses and not through mine, because being someone who was born in Africa and being someone who has come over here, I have a whole different worldview on things. And I'm in this space of also unlearning a lot of things that I learned as a child.
Right.
So I really try to intentionally, as a therapist, check myself in sessions. One, to make sure there is no sort of countertransference or transference happening in sessions, and also be very aware of my nonverbals, because that's also very key, because a client can easily pick up on something and interpret it as something else. The one thing for me is I try to like, number one, the one thing for me I've noticed in my career as being a counselor is feedback. I like feedback from my client because I want to know what I can do better. I want to know if there's something I did that was a trigger to you, just so I'm more aware for the next person that walks through my door. And I can really sit in the space to be like, I am making an effort to be better.
Right.
And not to make the same mistakes again. But the most important thing for me is really giving that disclosure at the very beginning that I'm still learning. Like I might mess up, but please give me the grace to do that. And if it's also something like you've mentioned earlier, you're not comfortable with that, I also understand it. Like I always tell my client, like, it's a relationship, just like any friendship or anything, it's a relationship, and everybody's not a fit for the other. So if there's any point in this, you feel like we're not a match, please let me know and I will refer you to someone else, because I know how important it is to feel lost and unheard in session when you are sitting across from the wrong person.
yeah, I think it's important just to kind of like start the conversation with your clients for sure.
Mhm. Oh, thank you. I actually love this. I think I'll probably be doing more Zoom now. It's a lot easier than like trying to travel. But no, this is a great conversation because for me as well, you as an individual helped me grow in
Mhm.
a lot of the things. You really get me to kind of hold the mirror back at myself and check myself and be like, okay, like why do you have a problem with this? And why is this such an issue? Which really lets me sit down and be like, okay, like is this a lot of things that we are just moving with what society says? Or is it because it's like my own true feelings about it? And so I'm also working through that, navigating through it, working through my own bullshit, and also trying to be the best person for my client. And it's a new journey, and I know it's going to be a long journey, but I think more conversations needs to be had, especially with people of color.
Yeah.
Schools need to do better, even if it's some sort of professional development, because the hospitals, anything, can be given more courses or anything to really keep each and every one of us in the health field to be more competent. We have to do our best to be more aware of things, to make things easier for people of color, people of different ethnicities. And we're not here saying we're perfect, because we're still learning, but
Yeah.
it's being open to learning, I think, is the most important thing.
Yeah, I think so too. And just kind of understanding where there are faults, even in your own understanding, and that like you kind of always have to be learning and unlearning certain things, which is totally fine.
Okay. So thank you so much for being here. Thank you so much for having this conversation. I'm going to do another sometime, probably next week. I will reach out to you. But that one is going to kind of be about how much we're trying to break the stigma of mental health, and what do you think we can do better? Because I think the death of Regina King's son really let me know that as much as we are trying to take away that stigma, there's still a huge stigma around it. And I'm seeing comments like, oh, his mom was rich, like what else did he want in life? And he was on red carpets, and what more does he want in life? And people fail to realize that, number one, we don't have enough Black male therapists, that someone like him could have felt comfortable enough to go talk to about having any sort of suicidal ideations. And what can we do, or what do you think we can work on? Do you think we need to talk more about it to be able to help with the stigma? Because I'm seeing too many people of color taking their own life, especially with COVID. And it's like, how as a community can we come together to work on it?